Hi, my name's Michelle. I've been with Experience for almost 8 months. I started in end of August and I can walk again. It's been amazing, absolutely amazing. From where I came in to where I am now, I couldn't sit, couldn't stand, I couldn't drive. I was out of work. I was in excruciating pain with several visits to and from the emergency room because of the pain. And after, I think within the month, I was back to being able to at least drive myself to my appointments and get back to work. I'm still working from home, but that's just a bonus. So, and it has just been ongoing improvement over week over week over week over week. I've been able to travel again. I've been able to get back to doing normal things, just even household chores and laundry, walking my dogs. It's been absolutely amazing. I don't know how I didn't get here sooner. My life before coming here was relatively active until I got hurt. And I initially got hurt in April of 2022, and that was a herniated disc that started to heal on its own, and then something triggered it to start pinching on my sciatic nerve, which is where the excruciating emergency room visit pain came into play. So that just completely debilitated me. I was bedridden. It was, for lack of any other description, it was debilitating pain just to go to the bathroom or to stand at the sink and brush my teeth. And then I found Experience. Actually, I found it on I think it was an Instagram post that I just said, you know what, let me try it. At this point, I am out of options. I can't live like this. And here I am. Drove myself, got ready, got dressed, back to work, traveling for work, traveling for vacations, almost back to normal. I still know my limitations because I'm not 100% yet, but I am at, I would say 95% to where I was in the negatives when I started here. With all of the changes that have taken place over the time that I've been here, I've been able to get free from the large amounts of medication that I was on for pain management, from muscle relaxers to painkillers. Even some of my depression medication has been able to be reduced because I'm active and feeling better again overall, not just physically. So I'm able to, be a little more happy with myself because I feel better and I'm not all groggy and in the clouds from all this medication from, gosh, they put me on morphine. I was on fentanyl they gave me at one point. They gave me OxyContin, gabapentin. I mean, the list goes on. I must have been on probably 12 or 14 different medications at any given time for pain management. And all it did was make me want to sleep, and it really did not alleviate the pain completely. This is what worked for me. At this point now, after being reduced down from all that medication, I am back to my pre-injury medication, which is just my basic, your high blood pressure and stomach medication for acid reflux. And I am in phase 2 of reducing my medication for depression, which is a big deal. And that'll hopefully help with movement and reducing the weight I gained from being sedentary and really get me back on track, back to 110%, hopefully. My progression of care here started with the full gamut of x-rays and, isolating where the real issues were. I started with chiropractic, soft adjustments, and then also laser treatment that was done in conjunction for quite a few months. I think I started out twice a week and then reduced down to once a week with the laser therapy, but still had adjustments twice a week. And then came SoftWave, which has been an absolute blessing to add on to all of the treatment that has already helped. SoftWave has brought all the healing properties to the areas that need it, that allows it to heal ongoing versus being stagnant and your body getting used to having that injury. It allows it to really heal and you feel better. I mean, I would do SoftWave every day of the week if I could, on every little ache and pain I have in my body, to just make myself feel better. So during that whole process, I was also going to a neurosurgeon to get to the root cause also of the pain, and found that my herniated disc was pinching up against my sciatic nerve because of a bone spur that I also have in that general area, which was going to require surgery to remove to avoid having these ongoing pain flare-ups. After 3 months, give or take a week or two, follow up with my neurosurgeon and an MRI in between, determined that I don't need surgery because everything had shifted back to where it's supposed to be, and the pain is not prevalent to flare up at any point in time unless I do something like, you know, cartwheels and backflips on the beach that would cause a problem. But otherwise, no surgery. I don't have any follow-ups with my neurosurgeon. I don't have any medication for my neurosurgeon. I just have to pick up on the phone and call him if for some reason something flares up. But I know that's not going to happen. If I was talking with someone who was considering coming here, I would tell them not to wait. Get it scheduled, get in there, because as soon as you meet everyone in here and have your first conversation with them, you know you're in the right place. The wealth of knowledge and support that we get from everyone in here, the comfort level, the family, so to speak. Like, I don't miss an appointment unless it's absolutely necessary due to illness or something along those lines. Otherwise, I'm here. And sometimes I stay afterwards and bother the front staff because we like to chit chat, because we're all family now. It hasn't even been a year, and we're all like, I could call one of them up probably and say, hey. Walking out of here feeling good is my favorite part of this practice, because I feel good physically and I feel good mentally because of the welcoming aspect of this and the ability the doctors have to just pinch me in the right places to keep me back on track. If I summed up my experience here in a word or a phrase, life-changing. Absolutely life-changing.